Okay, I think we can start. So thank you very much. Welcome for the second webinar of this series on health technology management in the Caribbean. So as I was mentioned before, so we had a very successful first session and a few weeks ago. We're very glad that we have this partnership with the University of Vermont, and more specifically, which is our WHO PAHO Collaborating Center on Health Technology Management, and more specifically, with Professor Tobey Clark. And so we have the pleasure and honor of having Professor Clark with us again this afternoon. The first webinar, we had 128 participants from 22 countries. Mostly it's targeted to the Caribbean countries, but we have also other countries outside the Caribbean that joined the session. Unfortunately for this edition, we had a few problems with the registration process in the Zoom platform, which caused issues that some participants have problems registering themselves for the webinar that we were able to fix yesterday. So this for sure has caused some problems for some of the participants, and so we may have still I can see here that it's still participants entering the room. But we are going to record the session, so for those participants that were not able to register, we are going to send the link for the recording afterwards, and we make sure that this problem does not happen again for the third webinar. So today we have if Gabriela could please share the next slide, please, probably the agenda. Yes, thank you. So today my colleague Begoña Sagastuyev is our sub-regional focal point for health technologies. So everybody knows Begoña. So Begoña, thank you very much again for your participation in this series. Begoña is going to be again our moderator for today. It will be passed the floor to Begoña in just a minute. We're going to have after that a live poll as audience characterization. Gabriela Jimenez and is going to lead this part, and also showing the community practice. And after we have the presentation from Professor Clark for 20 minutes, and then Q&A session. And after that, we hope to use the Slido platform to have a discussion about the challenges in the Caribbean and our next steps on addressing those challenges. We also organized a series of workshops. Some of the participants that are today have already participated in this workshop are target to local context, national context. We organized one with Suriname and the other one with Trinidad and Tobago. We are hoping to organize with other countries in the coming weeks and months. We are very glad to have been able to have these projects with the support from Begonia, from our colleagues in the country offices. I would like to thank also my colleagues in the country offices who have been supporting, of course, Professor Clark, and of course, the whole team in the HSS-MT that's been working very hard to make sure this series is a success. And of course, all the participants that have been joining our sessions. With this, I would like to pass the floor to my colleague, Begonia. Thank you very much. And Begonia is going to be our moderator, doing like a wonderful job as usual. Thank you, Begonia, and the floor is yours.
On the contrary, thank you, Alexander. I hope everyone is hearing me all right. I would like to welcome you again to this second webinar of the series Healthcare Technology Management in the Caribbean. As Alexander mentioned, my name is Begonia Sagastri. I'm a consultant for medicines and other health technologies at the PAHO Subregional Office for the Caribbean, and I will be moderating this session. So today we're going to be exploring and discussing a very interesting topic. We're going to try to work together and dialogue about how can we show the value of healthcare technology management. This means that we'll try to understand some principles about how we can show this value to other stakeholders, and we'll try to discuss some of the specific challenges that we may have in the Caribbean regarding this. Alexander already went through the agenda, so we won't go over it again. But remember that we're going to start with this exercise using Slido, where you will be required to answer some questions. So please help us participate in this. It's very important so we can have a good session. So without further delay, let's start. And I'm going to introduce Gabriela Jimenez, who is also a PAHO consultant, and she will be guiding us with this exercise. So Gabriela, over to you. Tell us how can we start with this exercise in Slido.
Thank you very much, Begonia. I'm trying to share my screen. So thank you very much. Well, so we will start with this exercise. Thank you very much for being here and welcome all of you. As maybe some of you have experienced before, we have this platform called slido.com. And the idea is that you all join with your cell phone or with your computer via slido.com and hashtag HTM Caribbean, or you can just take a picture or a photo with your phone. And we would like to hear you, like in which the first question is, in which country are you located? This is an exercise to know you, to know the audience, and yes, to have a bit more sense of who is in the other side of the screen. So thank you very much. We start having some answers from Belize, from Dominica, Santa Lucia, Trinidad and Tobago. Yes, so then more participants are joining. Suriname, Cayman Island. So yeah, we have big representation from Belize, more representation from Belize for the moment, and Trinidad and Tobago as well. Thank you very much. We have St. Kitts and Nevis, Grenada. Well, but then we have the two main countries and participants, in which country they are located. It's in Belize and Trinidad and Tobago. Yes, we will go to the next question, but the QR code will still there. So then please continue joining. So then we will go for the audience characterizations. As I said before, we would like to know in what type of institution do you currently work? Is it a hospital? Is it the Ministry of Health, an academic institution, non-governmental organization, an NGO, or PAHO, or other? Please, you can start answering this poll. I think the mode of this poll is that you have all the questions. You have 3 questions, and then you can start answering. When you answer the first question about the institution, then you can go to the next one and then the next one. So it's easier and faster, the interaction. So we have 50% from the Ministry of Health, 31% from hospitals, 35% from hospitals of the 19 users. Other. If you want, you can also type from which type of institution are you working. If it's other, your response. So then we have 42% of the participants from the Ministry of Health. Okay, that's the majority. Then in the question, what is your educational background? Then we have 24% of biomedical engineers and physicians, paramedic or nurses, 23%, other 15%, management and administrative, very important as well in this session. Biomedical equipment technician or other electromechanical field, 14%, so then it's changing. Thanks for the participation. So then we are even with the biomedical engineers and physician, paramedic, and nurses. We can go to the next question. This is very interesting. Thank you very much. And the next question is, what's your background knowledge in terms of health technology management? Intermediate, basic, advanced. And most of the participants said intermediate. Okay, well, and basic, the second one, and 12% advanced. Okay, so thank you very much for this exercise, for participating. Don't, well, we will use the Slido again at the end of the presentation. So please keep it open and keep it in mind that we can still using the computer or the phone to continue the interaction. Over to you, Begoña.
Well, thank you very much, Gabriela, for this. I think this is always a very interesting exercise. We did see several of you that were answering through the chat, which is also okay. However, for future exercise, if you're able to do Slido, that helps us do a better interaction with all of you. So thank you so much for this. And I love to see that we have a lot of biomedical engineers, and I saw a couple of names of people that already participated in the previous session. So glad to have all of you back again in this session. So right now we're going to talk a little bit about the community of practice that we have in the Caribbean. Again, Gabriela will be guiding us through this session. So Gabriela, please come back again here to the floor so that we can share with us about this community of practice.
Thank you. It's a couple of slides about to speak about the Caribbean countries' health technology planning and management community of practice. So these slides are only to invite you to the Caribbean countries HTPM community of practice. I don't know what's happening, but well, this is a virtual space and hosted in Praise, coordinated by Professor Tobey Clark. And then the idea is that you join this community. We will post the link in the chat, so then you can have the information to go to this link, and then you can have the information, and also a Google Forms in order to we have your information to put you in the community of practice. Yeah, I'm having some problems with the presentation, but the idea is that you join the community of practice, fill the registration form. You will receive an invitation to join, and the link is on the chat. So this is just informative for all the participants. Hope to everybody join this community of practice to continue interaction, not just in this session, but further.
Thanks, Gabriela, for that. We'll definitely be reminding everyone to join to this very interesting community of practice. As Gabriela said, the link to join is in the chat. I will probably put it again towards the end of the session in case that you forgot or you want to do it later on. So we will be sharing that with all of you. So now we're getting to one of our central parts of this webinar, which is the presentation by our keynote speaker, Professor Tobey Clark. As I said, I saw that some of you already participated in the previous session, but for all of those that this is your first time with us, let me introduce Professor Clark. He is director of the PAHO WHO Collaborating Center for HTM at the Technical Services Partnership in the University of Vermont, where he also serves as an engineering supervisor. He has also been on the faculty of Electrical and Biomedical Engineering and Biomedical and Health Sciences departments, where he has taught medical instrumentation and clinical engineering courses. Tobey has worked in the biomedical engineering area for about 49 years or so, and we're really happy to have him joining us in this very important session. So Professor Clark, thanks again for being with us. Over to you.
Thank you, Begonia, and thank you to the PAHO team and all the participants for being part of this webinar. So today we are going to focus on showing the value of healthcare technology management. This was a strong area in some of our previous discussions and webinars and workshops that seems to be something that is of high interest for people that are involved in healthcare technology management and others that are more involved in leadership activities. Next slide, please. So first of all, it's important to understand why healthcare technology management is essential. And your leaders need to know this. They need to know the different areas and also the impact of healthcare technology management. Certainly during the pandemic and at other times, the area of innovation, looking at emerging technologies, you need the type of skills that healthcare technology managers bring. Statistic is 50% of all diagnostic and treatment methods used today didn't even exist 10 years ago. Everything's moving fast. Patient safety is another very important area. I had a student go through our US Food and Drug Administration data for adverse event reportings and found that over 600,000 reports were made in 2018. This is a patient safety issue related to medical devices. When there is a patient safety issue and the patient has to stay in the hospital longer, or maybe they have to, for the rest of their life, be under chronic care, we're talking about billions of dollars annually for the expenditures to take care of those patients. As more devices get on networks, then we see that there are a lot of vulnerabilities that come up from cybersecurity, things such as ransomware, etc. It's been proven that even devices such as pacemakers can be hacked. So we have to really be concerned about cybersecurity. Of course, the cost of healthcare technology is high. Just for medical devices, it's over 400 billion globally in 2020. But at the same time, a study that was done in the US Congress found that technology in general was really the driving force that increased the costs for healthcare. Next slide, please. So when we talk about costs, we have to think about the total cost of ownership. And if remember from the first webinar that we gave, we talked about the iceberg, which shows that the acquisition costs, the purchase price and shipping, et cetera, is really only a small part of the total cost of ownership. When we add staffing and training and maintenance, consumables, utilities, upgrades, software licenses, et cetera, you know, that cost goes way up, and for the most part, it's much higher than the initial cost. So we have to educate the leaders of this activity that, you know, down the road during the life cycle, you're going to spend a lot of money on technology. Efficacy, Alexander Lemgruber has an excellent network for healthcare technology assessment. It really has to be assessed so that the outcomes are improved. Convergence of technology. I mentioned that medical devices are being connected to the networks. They're also being connected to telecommunication systems. The volume of devices, it depends across the spectrum of the globe, but anywhere from a couple of medical devices at each bedside to many hospitals have about 15 devices that is associated with each patient bed. And lastly, access. Access is definitely affected by healthcare technology. Next slide. So what if we don't manage technology? Well, here's a dramatic example of what happens when technology is not managed. And you can see in this case, there was a $78 million verdict, which was blamed on basically the healthcare technology not being managed, such that you know, a child was being born and the cesarean section was delayed because the ultrasound imaging unit basically said that the child wasn't alive, but in fact the child was alive. So what happened is they found that the ultrasound machine had not been calibrated for over 10 years, even though annual calibration was required. So the hospital ended up spending that money. Over. Next slide, please. So who's the staff of healthcare technology management? Next slide. So it varies depending upon the country, globally, US, Canada, parts of the Americas. Generally, biomedical or clinical engineers have a leadership role in healthcare technology management. They may be the director, the manager, or they may be a non-supervisory engineer. At the same time, there's technical staff. Sometimes they're called biomedical equipment technicians or technologists in Canada, medical technicians. The military in the US, they call them biomedical equipment specialists. Whatever the name is, they're technical people that focus on primarily the maintenance of the equipment. And there's various levels, specialists for things like imaging technologies. And of course, there's administrative and support staff that is necessary. More and more information technology staff and educators are part of that group. Everybody has to work together though. Next slide. So how do we define a clinical engineer? Well, I gave a talk and actually was in China 5 years ago. And somebody was asking me, how do you define a clinical engineer? And we have a term in the US called jack of all trades, which means, you know, basically you can fix anything, do anything. You have tools, you can make it happen. Well, I think that's one thing that a clinical engineer can be as analogy for a clinical engineer. But at the same time, you have to juggle a lot of different things. You have to juggle budgets, you have to juggle your information systems, maintenance, the clinical care. All of this has to be, you know, kind of juggled, and it's a complex job without any doubt. So I just want to congratulate all of you that are involved in healthcare technology management. It's not an easy job, and there's a lot of attributes associated with it. Next slide, please. Well, here's a long list of clinical engineering roles, and I'm using the word clinical engineering because that's kind of what I'm most familiar with, but it could be, again, biomedical engineering or biomedical equipment technician or whatever. There's various points in the medical equipment life cycle that you're asked to provide value. Everything from regulations, assessment, capital planning, product evaluation, project management, contract management, patient safety, retiring equipment, supporting your maintenance or facility staff in the hospital, maybe with electronic problems or difficult to resolve problems. We have a lot of engineers now that are involved in integrating medical devices into the network so that the data goes to the electronic health record. Incident investigations, education, consulting, and more. So there's many roles that the clinical engineer has. Next slide, please. So how do you show your value to leadership and clinical staff? Next slide, please. So I just wanted to bring up, this is kind of our vision statement, mission statement, values, and core competencies that we have for our department. So our vision is to be the premier provider of comprehensive technology management solutions for healthcare, research, education, and industry. So we not only work, because we're an academic institution in healthcare, but we also use the same principles to manage the research departments. They have a lot of equipment. They have a lot of similar issues as hospitals do. Same with education. We want to be the technical educators for healthcare technology. Mission, pretty straightforward, just be innovative, high quality, and cost effective. I like our values, integrity, accountability, innovation, teamwork, and quality. And then our core competency, which really is along the line of the rest of it. Next slide, please. One thing that I found that's really valuable is what's called a value proposition statement. This, I think, is something that leadership can understand, looking at these 4 factors. What's a discriminator? How are you discriminated against other ways of approaching the problems related to medical equipment? So a statement for your department might be, the healthcare technology management staff has the same goals as the Ministry of Health system or the health system in general. That is something that the vendors don't have that attribute. The HTM department is located in the healthcare facility. The same thing with insight. What is your insight? Well, we talked about the volume and complexity of devices. That's increasing. The cost of ownership. Those are 2 items that are important insights, and you can add to that. Benefits. What's the benefit? We want to always improve patient safety and the quality of diagnosis and treatment. That's kind of the mantra. And the maintenance management should not only improve the availability, but also the lower the cost. So why do we believe in this? Well, I think that all of the healthcare technology managers have had a really strong role during the pandemic and shown the value of HTM. Next slide, please. So let's talk a little bit about networks and resources. Next slide. So I wanted to bring your attention, if you're not aware of the International Federation of Medical and Biological Engineering, IFMBE. I know that they have official association with WHO as an NGO or non-governmental organization. They have a clinical engineering division, which is very active, and I know a number of you are tied in with IFMBE CED. So they're basically looking at healthcare needs, these qualified professionals, which are clinical engineers, to guide development, evaluation, installation, all those things that I went through previously. There's a very good paper that provides a lot of justification for clinical engineering, written by Yadin David and Tom Judd. And this is a link to that paper. It was published in 2020, and it goes through hundreds and hundreds of cases where healthcare technology management showed value in countries all over the world, 125 countries. These are all evidence-based studies. Another valuable resource is the WhatsApp network with hundreds of HTM professionals that are constantly interacting on that network. I don't have really a link for that, but I just want to make you aware of it at this point. Next slide, please. A group called the AMI, which is the Association for Advancement of Medical Instrumentation in the US, they have something called a levels guide, which allows you to evaluate your program versus kind of different levels. Now, these are US-based levels, fundamental, progressive, and advanced. And basically, you can look at the attributes of each particular area and understand where you might be within that rating system. So this is a self-rating type system. Next, please. The other thing that the AME organization has is something called HTM Week. And this is really a good opportunity for your department to maybe open up your doors, have a table with some of your accomplishments, whether it's a device or it's pictures of activities in the hospital, maybe some food, and get the clinical staff, get the leadership into your department to see what you really do. Another thing is posters, newsletters. In our office, we have an annual poster that goes out to all of our hospitals and all of our staff, where we honor our employees that have won awards, community service awards, and customer service awards. And this is when you walk in our office, you see those. Next slide, please. From the Canadian Medical and Biological Engineering Society, this is a little bit detailed. I'm not going to go through the whole thing, but an important point is that healthcare technology management goes well beyond being a lower cost alternative to vendor service and external consultants. The attributes of a clinical engineer cover a broad area. Strategic communications are important to get the word out at the highest levels about your work. And you should develop a script, sort of like an elevator pitch, when you're talking to leadership, so that they understand what you do in a short period of time. Building relationships is the second area, so lasting partnerships. And you need to cooperate with other aspects of the healthcare system. Next slide, please. So case studies always help. Next slide, please. So during the pandemic, again, it's a big opportunity for you to show your value. So, and I think many departments have. I've heard from a number of you about the activities that you're involved in, whether it's in Belize or Trinidad, Tobago, and other countries. Innovating solutions to the unique problems that we've had to face. The emergency medical devices, many places have developed those internally. Setting up surge units, whether it's a tent outside the hospital or whatever, for patients to be in, repairing equipment, new sources for needed medical equipment, evaluating equipment without typical approvals. So this requires a expertise to be able to look and see if, say, a ventilator from a country that you've never bought equipment from before has an adequate and safe system. Innovating in areas such as facilities and consumables, continuing to do your job despite the pandemic, and collaborating with other groups. Next slide, please. So I just wanted to go through one example of something that we did, which was kind of out of the box, because our engineers deal with instrumentation, but there was a need to re-sterilize N95 masks for reuse, because there weren't enough N95 masks, I guess you actually call them respirators, for our healthcare workers in our state of Vermont, USA. So we had to find a way to sterilize N95 respirators. So we looked at different methods, ultrasound, hot dry air, microwave, and hydrogen peroxide. Did some testing in our laboratory, ran some tests, UV and hydrogen peroxide primarily, sent it out to a national laboratory for results of sterility. And we came upon that hydrogen peroxide was the best solution. So we immediately ordered hydrogen peroxide sterilizers for 12 hospitals, and they were immediately used, and later the FDA approved that activity. So I just wanted to go through that one more slide, which is a summary of, again, first of all, you need to understand the need for healthcare technology management. Why are we doing it? The staffing, understanding, I'm sure you do, that you are able to do a broad range of things, both as technical people, but also understanding the clinical spectrum. Ensure that your department has a clear direction, and that is expressed to leadership. Value proposition is a statement is a good tool to use. The resources available, I provided those and utilize those resources. And if you have studies, case studies, or things that you've done that are great, share those with the leadership and clinical staff. So you're really essential, and want you to share that value that you bring to healthcare. Thank you.
Thank you very much for this presentation, Professor Clark. It was definitely very interesting. Now we're moving to our section of questions and answers. So I would like to remind all participants that you will see in the bottom of your screen a section either for the chat or also for questions and answers. Feel free to use any of them to share your questions to Professor Clark. I think we may also be able, if someone would like to speak up, to raise your hand, and we'll try to unmute your mic so you can also share your experiences. So we would really appreciate if you could share with us your questions or your thoughts regarding this presentation we received. Let me double check right now if we have something right now. Okay, here we're having a question regarding access to a clinical engineering WhatsApp group. I'm not sure if this is with you, Professor Clark, or it's something with Gabriela.
Yeah, I can provide that. Let me see if I can find it during the conference, and I'll put it in chat. It's basically through the IFMBE CED. Tom Judd is the leader of that group, and let me, probably the best thing to do is to get you his address, his email address. So I'll do that.
Thank you. That would definitely be of use. Alexander, I see that you turn on your camera. So
yeah, I mean, of course, all initiatives are welcome, and we know the efforts doing by the IFMBE and the CED. We also organizing together in a couple of months one activity with them that we are going to disseminate. It's an international meeting with the IFMBE. But having said that, I think one of the reasons we are developing and this kind of activities with webinars with the Caribbean country in the Caribbean is that we would like to have our own community. So that's why I have this community practices. I will really encourage you to join this community practice as the platform, the regional platform of Access Innovation, so we can exchange information, we can support you. So that's, I think, is the best way. Of course, that's if someone wants to join as a personal level, other initiative, that's the one that was just mentioned by Professor Clark, of course, it's totally fine. But I would really, in terms of institutional representation, I think it's really important that we do our focus on the community practices, that the sub-region, it's kind of sub-regional network. We're not calling it like a formal network, but it's a kind of sub-regional network that we would like to establish as this community practice. So please, I would like to invite you, I strongly suggest that you join this community practice. Thank you very much.
Thanks for that reminder, Alexander, and everyone remember that we have in the chat again, we put in there the link so that you can join this session, or well, this community of practice. And I would really encourage you to do so. We have other community of practices on other areas related to medicines and health technologies, and it's really interesting to be able to have this space to share experiences between countries with common backgrounds and common challenges. So we really do invite you to join this session. We have another question here from Candia that it says if we have any information on schools that offer biomedical technical training, technician training. I'm not aware of one specifically, so.
Yes, there's an excellent program that our university works with. They take interns from University of West Indies in Trinidad and Tobago. They have a biomedical engineering technology program, which is sort of between being a sort of engineer that designs things and an engineer that's technically focused. And that's a really good program that we work with regularly. There's, I'm sure, other programs in Jamaica. I know that we've had some interaction with Haiti. As far as other locations, I'm not really sure. So anybody else has anything in the chat? I see Paul Taylor put more specific information about University of West Indies in the chat.
Thanks for that. And for the question regarding the recording, yes, we will be making them available and be sharing more information about the recording of the sessions. And Professor Clark, taking the opportunity that we have you here, I would love to ask you a question if possible. I would like to know, what is your perception regarding the value of health technology management, and in what situations do you see the value of health technology management expressed? Are there certain situations when health technology management is not recognized for positively impacting services? I don't know if you have some sort of situations that you could share with us of when these things happen or do not happen.
Yeah, that's a good question that I was looking the participants to also provide some input on. But I think, in emergent situations such as the pandemic, where there is a high use of technology, I think that has really brought to the forefront the healthcare technology management groups across the world. If it's more kind of routine work, I think the perception is more, well, healthcare technology management is just maintaining the equipment and fixing it. But it really has to be more than that for the technology to be effective.
Thanks for that, Professor Clark. We have another question here in the chat asking if we could talk a little bit more about the assessment of number of technological devices to number of beds or public health clinics or populations. What are the measurement tools to ensure that there is access to our populations? And we have another very interesting question here saying that health technology management setup is costly. How do you see a Caribbean country such as Haiti or with limited resources taking the steps to really initiate health technology management?
Okay, I guess I'll start with the first question related to assessment of number of technological devices to the number of beds or public health clinics or population. In general, the development of health technology management is pretty much directly related to not only the number of devices, but the complexity of those devices. So obviously something like a computed tomography scanner is more complex than an infusion pump. So that would weight the amount of work on the CT scanner to a higher value. But in general, I think it's in the US, which is not a good comparator, it's about 1,000 devices for each person in a department. As far as HTM setup is too costly, I think that it shouldn't be that costly. I think if you look at the value proposition statement, that you can see that the value of HTM can be realized. Certainly in working in Haiti recently, there is a big focus on just getting things to work right. And that certainly is a very primary job. But from there, you should be able to work into the other areas. Over. Looks like there's another question about number up-to-date ultrasounds for maternal and child health OBGYN services. And that is related to, I guess, the number of equipment. I don't know if I can answer that question specifically. Certainly ultrasound is very important for maternal and child health. I can't really tell you how many you need for population or whatever. Perhaps, I don't know if Alexandre or would have any comments on that. Hate to put you on the spot.
I think that question maybe falls a little bit more on the planning of health services, but that is something that we could definitely look for to provide some tools and guidance in future presentations. So if you all agree, given the time, I think we need to go to our last part of this session, which again will be led by Gabriela. We will be discussing a little bit more of the specific challenges that we have in the region, and I believe we'll be using Slido again. So remember, we invite you to use this tool because it makes exchange of information easier between all of us. You can just type in your web searcher, for example, in Google or Yahoo, I'm not sure which one you're using, slido.com, and you will be able to enter to this questionnaire using the hashtag HTM Caribbean, as you see here in the screen. Or you can also take the picture with your phone of the QR code that is at the top, and you will be directly entering the survey. So Gabriela, over to you.
Thank you, Begonia. Yes, we will continue this interaction with you, and we will speak about the perceptions and challenges in terms of HTM in your country. And the first question, it's a really open question, like what's your perception regarding the value of health technology management in your country? Like taking into account all this presentation and definitions and also some strategies that Professor Clark presented. But what is your perception now? It's an open question. You can put some comments, even words. Uncertain if we are addressing this area aggressively, not well developed. We have the first two comments, very basic, but we are moving towards solutions that we can afford and that also work. Thank you. Sufficient value is not being placed on HTM in the Caribbean. If you would like to express more in the chat, don't hesitate. Emerging recognition of the importance and impact of HTM. Okay, so that I think that that's something that we as well encounter, like emerging recognition since these last years, for planning, for management, for maintaining the technology. Emerging recognition ensures value for money and consider adequately total cost of ownership, also fit for purpose. Yes, ensures value for money. It's the same comment. Yes, exactly. That health technology management exactly ensures value for money. And then, well, about the situation and the perception, a lot of room of improvement. Underfunded, very relevant, but undervalued. I believe that this is still in the early stages, although there are some people that are trying to develop it and try to follow the best practices in HTM. Various aspects impact the efficiency of HTM. It's true that it's a very interlinked discipline. Undervalue needs improvement. Its value is not well recognized. Professor Clark, do you have any other comment regarding these first ideas that we got?
Yeah, the only comment is, related to the pandemic, if the value perception has increased because of the work that you've done.
Mm-hmm. Thank you, Professor Clark. It is needed to efficient management of limited resources, but it needs to be integrated and planned with proper infrastructure to sustain it. Yeah, that's well said. Do we have any other comment? Maybe we can pass to the next question. Yeah, we can pass to the next question. And the next question is about choosing the main challenge that you face in the country in regards to HTM. And if you choose other, please comment on the chat or just let us know if you would like to have some interaction, and then we have the first as the first challenge, lack of understanding of the value of healthcare technology management. Well, fortunately, we saw some strategies during this webinar. Like establishment of the value, proposition to the management, resources, networks, creating networks, that's very important, goal setting. And the second main challenge perceived for you, it's the inadequate user and service training, then lack of standardization of common medical equipment, lack of adequate medical equipment, consumables, and accessories, the fourth one. There are many challenges as well. If you have other challenges that are not mentioned in this list, please just type them in the chat. Do we have other comments? No, into the chat, no. But yes, we have, as the first, from the 24 participants, the first challenge observed is this lack of understanding of the value. I hope this presentation helped you to understand better other strategies that can be put in place to communicate this value and to put it upfront. Do we have any other comment, question? If not, I think that, I pass it over to you, Begoña, to the closing.
Thank you very much for that, Gabriela. So we come to the end of our session today. I would like to thank all of you for joining us again. Please keep mindful that we will be sharing the information regarding the recording and also information about our next session. I'm not sure if we have a date yet. I think not, but we will be communicating this to you in the next couple of weeks. So thanks again for joining us. I would like to give the floor now to Alexander so he can give us a couple of closing remarks. And it's a pleasure to be with you today. I hope to see you in the next webinar. Over to you, Alexander.
Thank you very much, Begoña, for once again wonderful moderation. I would like also to thank Gabriela Jimenez for all the hard work, and other colleagues in our units that work a lot to make possible these activities. Also, of course, all the participants. We have more than 70 participants with all the challenges we had with the Zoom platform last week and this week. But we had a very, very good number of participants. So thank you very much for the questions. And of course, Professor Clark for, again, a wonderful presentation. We have a tentative date. We're going to confirm in the next few days. Until next week, we're going to confirm for the third webinar. But please reserve in your calendar September 29 as the date of the next webinar. We're going to confirm the time and confirm the date. But for now, if you could please save the date on the 29th of September, I would appreciate. The topic today was really important about the value, and we can see from the response that we chose the one of the topics to consider the main priority. You can see that the issue of doing this advocacy and work with decision makers to make sure they really understand the value of the health, the HTM, in the whole process of technology life cycle and decision-making process. I think it's a really important topic that we can work together and again emphasize the importance of this network collaboration, that we can work through the community of practices, building capacity, working together so we can strengthen health technology management in the region, but more particularly and in the Caribbean countries, that our focus and priority right now is PAHO, is working with you, with those countries, so we can build this network, a sub-region network. And we can see that I have been in PAHO for now I'm completing 10 years at PAHO as the regional advisor for health technology management. I can tell you all that in the since the start of the pandemic, so last year, February, March last year, we can, for the first time, I can see that the medical devices and medical devices, and in particular the health technology management topics, now there are much more people that are considered them as priorities. So even inside the organization, some areas that never contact us with requests, country offices as well. Some of the country offices requesting support that they did need before they were not requesting. As part of this is show the importance of medical devices. And of course, we all know about this since we know about the importance, but the pandemic emphasized the importance. But since at the beginning was no vaccine, so about all the PPEs and the IVDs and the biomedical equipment. So so with all the challenges we have to face and to address the challenge by this pandemic, one thing that came and they're going to, it's our role as engineers, as healthcare workers, and to show the importance of this, not only to address a very important topic, of course, is addressing the challenges posed by emergency, by a pandemic, but showing that building this capacity and making sure that we have access to cost-effective technologies, that we use health technology assessment tools to make decisions, that are we addressing the challenges on health technology management as those that were raised by Professor Clark in those two webinars. So this, it's really important that we can show this importance to decision makers. So we show building this awareness, mobilizing funds that are important to address those priorities. So this is definitely a thing that I can see that more and more the countries and sectors that are not paying attention for those topics now are paying attention about the quality issues, the quality assurance of those medical devices, strengthening the importance of that, about strengthening the regulation of medical devices. That it's in some countries, for example, and in most of the countries, I see that is still prioritizing regulation of medicines, but now more and more giving attention to the importance of the strengthening medical device regulation as well. So I think we have still lots of challenges in front of us, but we are now in a position that we can address those challenges and working together to address them. I think, and this we can, if we can give our piece of contribution as part of this process, as the Pan American Health Organization and World Health Organization, together, I think we can address those challenges. So thank you very much again for your participation. We are going to be in touch in the coming weeks and months with this project. And thank you again to all the participants, Begonia, Gabriela, Professor Clark. So we see you in a few weeks. Thank you very much.
Bye, everyone.